Have you ever heard that saying, you can be fit and fat? Well, it might not be as crazy as it sounds. Buckle up, because we're diving deep into a groundbreaking new definition of obesity and why it matters more than just the number on your...
So we're moving past that old obesity equals disease narrative. This deep dive is all about understanding when excess weight actually translates into a diagnosable condition. And it all starts with this 2025 report from the Lancet Commission, a team of 58 global experts.
58 experts. That's a serious brain trust. So what's the big takeaway here? Are they saying obesity isn't a problem?
They're making a crucial distinction between preclinical and clinical obesity. Think of preclinical obesity like having a few too many unread emails in your inbox. Cluttered could be a problem later. Your organs are functioning normally, but that extra weight is a risk factor.
So preclinical obesity is like a warning light, not a 5-alarm fire. What about clinical obesity then? Is that when the inbox explodes and takes down the whole server?
Exactly. Clinical obesity is when excess weight has already started to negatively impact how your organs work. We're talking measurable changes in your heart, lungs, liver, even your brain. It's not just about future risk anymore. It's about present measurable harm.
So how do we know if someone has crossed that line from preclinical to clinical obesity? Is it all about BMI?
BMI and waist circumference are helpful for assessing risk, but they don't tell the story. You could have a high BMI and be perfectly healthy, or have a normal BMI and experience clinical obesity.
Someone could look relatively normal, but still have these internal issues going on. That's a little scary, to be honest.
This is why looking beyond the scale is so important. The Commission proposes specific criteria to identify clinical obesity, focusing on signs and symptoms of organ dysfunction.
Give me an example. What kind of signs are we talking about?
Let's start with the heart.
Okay.
Picture this. Your heart is working overtime like a delivery driver during the holidays, struggling to pump blood through your body because of the added weight. It can lead to chronic fatigue, swelling in your legs. We call that edema. Or even an irregular heartbeat known as atrial fibrillation.
So we're not just talking about vague risks here.
No.
Tangible symptoms people are experiencing right now.
Yes.
What about the lungs? You mentioned those earlier.
Imagine your lungs being squeezed like they're wearing a tight sweater. That extra weight can restrict your ability to breathe, leading to shortness of breath, especially when you exert yourself.
Yeah.
And then there's sleep apnea, where your airway becomes obstructed, causing you to stop breathing during sleep.
I've heard about fatty liver disease too. Does the Commission address that?
They highlight what we call metabolic dysfunction-associated liver disease.
Okay.
Essentially, it's a fancy way of saying fatty liver disease caused by metabolic problems, and it can lead to serious complications like cirrhosis and liver failure.
Even if someone isn't feeling winded or constantly tired, they could still have damage happening internally.
That's the thing with clinical obesity. The signs can be subtle, and that's why this new definition is so crucial. It helps us identify those who need intervention before things escalate. It's not limited to the heart, lungs, and liver.
Where else can this dysfunction show up?
The Commission's criteria cover a wide range of systems. You've got the kidneys, the reproductive system, the central nervous system, that's your brain and spinal cord. Excess weight, especially around the abdomen, can increase pressure inside your skull.
Okay.
This can lead to headaches, vision problems, even balance issues.
Okay, that's not something I'd want to experience.
Right.
What about younger people? Does clinical obesity look different in children and adolescents?
And this is a really important point. The Commission dedicates a whole section to this issue. Children's bodies are still developing, so they might be able to compensate for some organ dysfunction better than adults.
So they could have some of these issues brewing, but not showing obvious symptoms.
Exactly. That's why early intervention is so crucial.
If we address these problems early on, we have a better chance of preventing serious health consequences down the road. So what kind of problems are we talking about specifically?
Musculoskeletal issues are common. Think knee pain, flat feet, even a hip problem called slipped capital femoral epiphysis. These things can significantly impact a child's quality of life and their ability to be active.
It's heartbreaking to think about kids going through that. Okay, we've covered a lot of ground here, but we're just scratching the surface. So much to unpack with this new understanding of clinical obesity.
Absolutely. In the next part of our deep dive, we'll explore how this impacts treatment and prevention strategies.
And ready to tackle the million-dollar question, how do we treat clinical obesity? I'm guessing it's not as simple as eat less, move more.
You're catching on. The commission challenges that weight loss should be the sole focus of treatment. They emphasize targeting the root cause, the specific organ dysfunction, not just the number on the scale.
So it's about improving how the body functions, not just shrinking it.
Precisely, for some, significant weight loss might be necessary to achieve that, but for others, it might not be the primary goal. The key is to personalize the approach.
What does that personalized approach actually look like?
Imagine a patient struggling to breathe because their lungs are restricted. The goal wouldn't just be to help them lose weight, but to improve their lung capacity. Their treatment plan might include pulmonary rehabilitation or respiratory therapy, alongside strategies for weight management.
So it's like a multi-pronged attack, addressing the immediate symptoms while also working on the underlying weight issue.
Exactly. That principle applies to other organ systems too. Liver dysfunction focus on improving liver function through medication or dietary changes, alongside any weight loss efforts.
This is a game changer. About addressing the specific problem, not just the general concept of obesity.
It's about empowering patients to take an active role in their care. Now that you understand clinical obesity and its potential manifestations, you're better equipped to have informed conversations with your healthcare providers.
You can ask specific questions about signs of organ dysfunction or treatment goals tailored to your situation. This deep dive is giving you the knowledge to be your own health advocate.
Speaking of advocating, we can't ignore the stigma surrounding obesity. The Commission stresses that weight bias in healthcare and society can hinder effective treatment.
It's true, when people feel judged or blamed for their weight, they're less likely to seek help.
Right.
It creates a cycle of shame.
The Commission calls for education and a new public narrative around obesity, based on science and compassion, not stereotypes and prejudice.
It's about time we ditch those harmful stereotypes. What should they do?
First, knowledge is power. If you have concerns, consult a healthcare professional.
This deep dive has equipped you with the vocabulary and knowledge to start a productive conversation with your doctor.
And remember, it's not about blame or shame. It's about taking control of your health.
We've talked about treatment, but what about preventing clinical obesity in the first place? What does the Commission recommend?
They call for a multi-pronged approach, urging policymakers to implement evidence-based public health strategies that promote healthy diets, increase physical activity, and address the social and environmental factors contributing to obesity.
It's about creating environments that support healthy choices, rather than placing the blame solely on individuals.
Exactly. Blaming individuals ignores the complex interplay of factors at play.
Right.
We need a holistic approach that empowers individuals while addressing systemic issues.
We can't expect people to make healthy choices if those choices aren't readily available or affordable. What about access to treatment for those who need it?
The Commission advocates for equitable access to evidence-based treatments for clinical obesity, regardless of socioeconomic status or other factors.
That's so important. For too long, people with obesity have faced barriers to care, whether due to lack of insurance coverage, high costs, or even discrimination from healthcare providers.
Yeah, we need to break down those barriers and create a healthcare system focused on helping people achieve optimal health and well-being.
This has been a truly eye-opening conversation. It feels like we've only scratched the surface of this new understanding of clinical obesity.
There's so much more to explore. The Lancet Commission report is a game changer, laying the foundation for future research and policy changes.
And speaking of exploring further, in our final segment, we'll tackle a question the Commission left unanswered: how to stage clinical obesity. Stay with us. We've been deep diving into this groundbreaking concept of clinical obesity and how it shifts our understanding of weight and health. One thing that struck me is that the Commission didn't provide a way to stage clinical obesity. How do we determine if someone has a mild or severe form of the condition?
It's a great question, and one that researchers and clinicians will need to address moving forward. Developing a standardized staging system could help guide treatment decisions and offer a precise way to assess the severity of the illness.
How would those stages be defined? Would it be based on the number of organs affected, the degree of dysfunction, or the impact on daily activities? It's a head scratcher.
It raises a fascinating question about what we prioritize when defining severity. Do we focus solely on the physical impact on the body, or do we also consider the psychosocial aspects, like the stigma and discrimination many people with obesity face?
Those psychosocial factors can significantly impact a person's quality of life, even if their physical symptoms are relatively mild. It's about how you feel in your body.
Precisely. And that's why a holistic view of clinical obesity is so important. We need to acknowledge that it's not just a physical condition, but one that affects the whole person.
Let's put on our thinking caps. If we were tasked with creating a staging system for clinical obesity, where would we start? What factors should we consider?
I think a multifaceted approach is essential. I could incorporate a point system, assigning points for each organ system affected, the severity of the dysfunction, the level of impact on daily life, and even the presence of other obesity-related diseases.
We could also factor in the patient's age, overall health status, and their access to resources and support. It needs to be a system that's both comprehensive and personalized, recognizing that everyone's experience with clinical obesity is unique.
This is a perfect example of how this deep dive can spark further discussion and exploration. The Commission's report has provided a framework. It's up to all of us researchers, clinicians, policymakers, and individuals to keep the conversation going and work toward a future where clinical obesity is better understood, treated, and ultimately prevented.
To our listeners, we challenge you. What do you think a staging system for clinical obesity should look like? What factors should be considered? Share your thoughts on social media using the hashtag Clinical Obesity Deep Dive. We're eager to hear your perspectives.
And remember, if you're concerned about your health or the health of someone you love, don't hesitate to reach out to a healthcare professional. The more we understand about clinical obesity, the better equipped we'll be to address it effectively.
Knowledge is power, and this deep dive has hopefully given you the information you need to take charge of your health. Until next time, keep diving deep and keep those brains engaged.